Okay, good afternoon, Teamsters Local 2010 members. Welcome to our first Teamsters Local 2010 webinar where we're going to be discussing the union's response to the COVID-19 crisis. Thank you everybody for being on this webinar. We had over 500 members sign up to participate, and we're glad that we have the opportunity to be together, share information here. I'm Jason Rabinowitz, Secretary-Treasurer Teamsters Local 2010. Our union is proud to represent 14,000 hardworking employees throughout the University of California and California State University systems. And we all know that we're facing a national crisis. It's a health crisis that is quickly becoming an economic crisis for our country. That is having already an impact on our economy that's put millions of people out of work across the country. We have many thousands of our fellow Americans that are sick, and unfortunately we have many that have succumbed to this disease. And so this is a time where our country needs to pull together, and especially our Teamsters union needs to pull together to face the challenge. And I'm very proud that in the face of this crisis that the 1.4 million Teamsters across the country have been working tirelessly, performing essential services, keeping America safe, keeping America moving, the stores filled with food, and public services running. And our 14,000 local 2010 Teamsters throughout UC and CSU are no exception. Our essential services workers, 911 dispatchers, payroll and financial workers, skilled trades workers, hospital workers, administrative support workers, and more are working tirelessly providing critical services to the community during this crisis. But meanwhile, our union is working day and night to make sure that as our members are providing services to the community, that workers are kept safe, that appropriate social distancing, telework opportunities, appropriate cleaning, PPE with proper training is all being provided. And we're also working day and night to make sure that our jobs, our livelihood, our benefits are protected as much as possible through this crisis. So we've been every single day on the phone, on conference calls with top UC leadership and CSU leadership on all of these issues. Our union representatives, all of our staff are working round the clock, working remotely. Our offices are closed because of stay-at-home orders, but our union is open for business, and we are working diligently day and night to in order to protect our members' rights during this crisis. So a little bit of an update on some of the things that we've been pushing and that we've won. So when this crisis first hit, our union took the position from day one, our members' livelihood and benefits should be protected. That means our position is no layoffs, no curtailments, no loss of pay or benefits for the duration of this crisis. And that's a big lift because millions of Americans are out of work, because the California state budget is heavily impacted by this. We're looking at potentially huge shortfalls in the budget, but UC and CSU are still open for business. They're still providing education remotely. They're still providing health services at UC, and most of the revenue stream is continuing for the time being. And our members are working hard keeping the place running, so it's very important that our members continue to be paid. So initially, we won from both UC and CSU 128 hours of paid administrative leave for COVID-related absences. We're very proud of that. We won, we've fought tooth and nail and won for thousands of workers to telework wherever it's possible. In some cases, entire call centers, we were able to get them to buy everyone a computer, send them home to telework safely. Our position is that we're ready to serve or ready to work, but where telework opportunities are possible, that should be followed. And we've won PPE and other safety measures in a lot of workplaces where our essential members are continuing to work on site. We're also very proud of our big win that we got yesterday. You may have seen the emails. We've been demanding no layoffs for weeks. We've had our petition. We've had our, which by the way, over 1,000 of our members have signed the petition already. And we've been on the phone with UC and CSU every day, speaking at Board of Regents meetings, trustees meetings. We worked with the other unions at UC to send a letter to President Napolitano demanding no layoffs. And yesterday our efforts paid off because UC announced that they commit to no COVID-related layoffs through June 30th. So that's a really good achievement for us. However, we need to keep on pushing because we need to have extension of the paid administrative leave. 128 hours is going to run out for some people very soon. I'm very happy to say that we got CSU, where 1,100 of our skilled trades members are working, to extend paid administrative leave from 128 to 256 hours. That just came a couple days ago. And we need to continue pushing on that. We are continuing pushing because UC needs to follow suit and do the right thing and extend the 128 hours. And then on the flip side, CSU, we're demanding make the same commitment to no layoffs through the fiscal year that UC made. So we're pushing on that also. We've been pushing for emergency pay and hazard pay. And we were successful in winning that for our CSU members, where that's in the contract. Emergency pay is in the contract there. They didn't want to provide it at first. They said, oh, it's an emergency, but we're not closed. Well, of course, that was ridiculous because for all intents and purposes, they were closed, and we were successful in winning emergency pay at CSU. So we'll be pushing for something similar at UC. Keeping in mind it's a bigger lift at UC because it's not there in our contracts, but we're pushing on that. We've come quite a long ways in terms of what we've been able to accomplish, but there's still more to be done. Teamsters Local 2010 is going to keep pushing day and night to make sure that our safety is protected in the workplace and that our pay and benefits are protected throughout this crisis. I want to say this is going to be an ongoing struggle because the effects of this are going to be with us in the economy for years to come. We're in bargaining right now for CSU skilled trades and for several of our UC skilled trades groups. Needless to say, this is going to have an impact on bargaining. Bargaining we're going to continue at bargaining as soon as we can, but we're going to find out pretty soon what's going to be the impact of this on the economics in bargaining. So at any rate, we're doing a lot in Teamsters Local 2010. I'm always proud to be a Teamster, but I've never been more proud than I am right now to see how our union is stepping up, how our members are working day and night providing essential services, and how our union is standing strong and standing together to protect workers' safety and workers' livelihood during this crisis. So we have a really good panel today of experts. Let me just let you know who's going to be speaking. We have Lamont Byrd, who's director of the IBT Health and Safety Department. Is going to be speaking about maintaining a safe and healthy workplace during the crisis. Then we have two of our esteemed attorneys, Chief Counsel of Local 2010, John Varga, and Attorney Lorrie Bradley from Beeson Tayer and Bodine, who will be speaking on our rights during the crisis. Then we're going to have a question and answer, and we received dozens of questions, so we'll try to get to all of them. If any of the questions are not answered, you'll have the opportunity to have them answered via email. Also, we're going to do more of these as the crisis continues. Then we're going to have closing remarks from our President, Catherine Cobb, and then we'll end the call in an hour. We're going to stick to our time. So Thanks to everyone for being on. And now I'm going to turn the call over to Director Lamont Byrd from IBT Health and Safety to speak about maintaining safe and healthy workplace during the crisis. Lamont, thank you so much for joining us.
Okay, thank you very much for inviting me, Jason. And I want to thank 2010 Executive Board for inviting me here as well. I'd like to talk with you about measures that we can take to protect ourselves from the virus that's causing this pandemic. There's currently no vaccine or antiviral treatments for the SARS-CoV-2 virus that causes COVID-19, also known as coronavirus 19 disease. Many of the jobs that you all perform as Teamsters are deemed to be essential, and due to the nature of the work that you perform, it may place you at risk of exposure to coronavirus. So with this information in mind, it's important that you take the necessary precautions to protect your health and the health of your family and your coworkers. So I would strongly urge you to familiarize yourself with the guidance provided by the Centers for Disease Control, the World Health Organization, Cal-OSHA. And you can access this information at their websites and on Teamster websites. The IBT Safety and Health Department has compiled this information in easy to read fact sheets that can be viewed and downloaded at www.teamstersafety.org or teamster.org. So before we talk about how we protect ourselves, let's just talk briefly about how the virus is transmitted. So this virus is primarily spread through airborne transmission. When a person who's infected with the virus coughs, sneezes, talks, or breathes, the virus they carry can become airborne. And it's carried in small droplets that come from the mouth and nose. Once the virus becomes airborne, then if we're sharing space with that person, we can inhale that virus into our mouth and nose and ultimately into our lungs and become infected. The virus can also be transmitted by touching contaminated surfaces. So when the virus is aerosolized, it will eventually settle on surfaces. And when we touch those surfaces with our hands and then touch our mouth, nose, or eyes, we can become infected. And there's also evidence that the virus has been isolated in stool samples from people who've been confirmed as positive for the virus, but contact with fecal matter is not thought to be a significant way people are becoming infected. But if your work requires that you come into contact with human waste, this is something you want to be mindful of. So how do we protect ourselves from exposure? According to the Centers for Disease Control and other experts, the most powerful tool that we have to protect ourselves is social distancing. This means staying at least 6 feet away from other people. If we don't breathe in the air that infected people exhale, then we can't be exposed by airborne transmission. We're also advised to use soap and running water and practice good hand washing hygiene by washing our hands for at least 20 seconds. If soap and water is not available, then use hand sanitizer that contains at least 60% alcohol. As I mentioned earlier, the virus can be transmitted through contact with contaminated surfaces, so it's important that we frequently clean and disinfect high-touch areas such as doors, doorknobs, handrails, or if you operate a vehicle, steering wheels, turn signal stems, gear shifters, etc. It's important to use cleaning and disinfecting products that are on the EPA list of approved products. That list can be found on the Teamster website as well. But just to kind of give you an idea, that list of products is over 20 pages long. So most of the over-the-counter products that we buy will work. If your work requires that you have to meet in groups, practice social distancing. That means maintaining at least 6 feet of space between you and other people. No handshaking, no kisses or hugs, and keep your group as small as possible. Meet in well-ventilated areas, and keep the meetings as short as possible since the potential for exposure increases the longer you're in that contaminated airspace. You should always cover your coughs and sneezes with your shoulder or elbow, never your hand. Don't go to work if you're sick or have symptoms that are consistent with COVID-19. That would typically be fever, shortness of breath, and a dry cough. Stay away from people who are obviously sick, but note that there's increasing evidence that asymptomatic people who are positive for COVID-19 can still transmit the virus, so social distancing is critical. These are a few practices that we should employ to stay safe. You can find more information, as I mentioned earlier, at teamstersafety.org, teamster.org, the websites for CDC, Cal OSHA, and the World Health Organization. Again, Jason and the executive board of your local 2010, thanks for inviting me to share information with you, and I'll stay around for any questions you may have. Thank you.
Thank you, Lamont. We really appreciate the work that the IBT Health and Safety Department is doing right now. Folks should know that Lamont and his whole team have been working tirelessly to get all of this information and resources out to all the locals. And we appreciate it, Lamont. And we also appreciate you taking the time to be with us today. So thank you. Okay, so next on our agenda is our legal update on our rights under the collective bargaining agreements, the executive orders, and the stimulus bills. And our speakers are attorneys John Varga, our Local 2010 Chief Counsel, and Lorrie Bradley, attorney from Beeson Tayer and Bodine. So I'll turn it to John to start.
Thank you very much, Jason. I want to echo Director Lamont's sentiments that the fact that our local is bringing everyone together in this time of crisis is really impressive. Everyone at the local is learning things that we never thought we'd have to learn, like how to use a Zoom conference and put together a webinar. And there's a lot of behind the scenes work that's going into doing these things. I also want to thank everyone who's on the call. Lord knows right now, finding any amount of free time you can to take care of what you need to take care of has been really difficult. So the fact that you're on this call during your lunch break speaks a lot to your concerns and the concern you have for your coworkers. And so I applaud you for making the effort to be here. And I do certainly hope that you spread the information that we give you on this call. So what I want to do first is assure everyone that all the negotiated collective bargaining agreements for Local 2010 members are still in place, meaning all of the obligations and responsibilities that the employer has to our members and to those in our represented bargaining units still exists. So I want to highlight a couple of those now. The first of which is that every Teamsters Local 2010 negotiated contract contains provisions obligating the University of California and the California State University to provide safe and healthy workplaces. And we are enforcing those provisions. And to that extent, we are making the following demands as part of the university's obligations to keep our workplaces safe and healthy. First of which is to provide the opportunity to work from home where possible, including providing the necessary equipment or software when that is what is necessary to work from home. I know Jason has spoken to this, that we've had several successes on that front, and we continue to advocate for the provision of necessary equipment so that workers that can work from home do work from home in order to keep themselves and their coworkers and their families safe. We are also advocating for employees to work with their supervisors to create work plans so that you can work from home. Keep in mind, a lot of managers are scared throughout this too, and their heads may not be on straight. And sometimes it's our duty, whether we like it or not, to help them straighten things out. And that may mean going to them and explaining that you can work from home, that you have put a plan together, or you want to work with them to put a plan together to facilitate that. And we are impressing upon the employer to work with their managers and supervisors to make sure that's done in each department as well. Finally, one of the suggestions that the CDC as well as Cal OSHA have made for employers is to create flexible schedules that would allow those working from home to care for their child if necessary, while still carrying out the essential functions of their position. So just because typically you work a 9 to 5 or something akin to that, when you're going into the workplace, perhaps working from home, you don't have that same opportunity. So the employer should be flexible with respect to how it is you're able to get the work done that you need to get done. So if in fact you are able to work from home and have not yet brought that to the attention of your supervisor, we suggest that you do that. If you have the ability to work from home and your supervisor for some reason has denied that possibility, please do bring it to the attention of your field representative, because we are advocating for that very strongly. For those who are required to come into work, the employer has the same responsibility to keep the workplace safe and healthy. And to that end, we are demanding that the employer provide training and education regarding safe distancing, hand washing, and workplace cleanliness. And to be sure, it's our position and the position of virtually every agency that I've seen that that is a responsibility of keeping a safe and healthy workplace, to provide that training and education. The employer, we believe also, our position is, and the employer for the most part has agreed, that the obligation includes arranging workstations to maintain necessary distancing between employees, to provide supplies that are necessary to keep employees healthy. And that includes, but is in no way limited to, hand washing opportunities, whether that be a station or a nearby restroom, cleaning supplies in order to keep the workplace clean as necessary, and of course, personal protective equipment, PPE, when that is necessary as well. And finally, again, on the issue of flexible schedules, to the extent possible, in order to maintain a safe and healthy workplace, an employer should give the opportunity to have a flexible schedule in order to limit the amount of employees in the workplace at one time, and in order to maintain a safe distancing from each other. And these are some of the things that we have brought to the university as our demands. And I'm pleased to say that in many locations, though we continue to fight for it at all locations, we've been successful in achieving that. So once again, I want to point out that our collective bargaining agreements do remain in effect, and this includes that obligation to keep the workplace safe and healthy. And because our collective bargainings are still in agreements are still in effect, that means we also have the right to file a grievance should the university be in violation of their obligations under our contracts. And I can assure you that our reps are staying on top of that. If you have reason to believe that your workplace is not safe and healthy, or your manager or department is not taking reasonable steps to keep it that way, please do let your field rep know, because that not only violates common sense and morality, it also violates our contract. And we are enforcing the terms of our contract. Now, I also want to go to if you are not able to go into work because your workplace has been shut down, and if for some reason you are not able to work from home, you do have the opportunity to use paid leave where eligible. As many of you know, and as Jason has already pointed out, both the University of California and California State Universities have issued executive orders that provide for 128 hours in the case of the University of California and 256 hours for CSU of paid administrative leave. I'm going to describe briefly the eligibility requirements for that leave in a moment. But assuming you are eligible to use the leave, the paid administrative leave may be used before using the leave in your bank. You are not obligated to use up all of your vacation or sick leave prior to using this paid administrative leave. Alternatively, you can use up all your paid leave first and then use the administrative leave if for some reason that benefits you in whatever situation you're in. I'll also point out the leave does not need to be used all at once in one big chunk. So for example, we've been advocating for arrangements in which a person is permitted to work from home and does work from home, but based on their childcare needs are not able to work the full 40-hour work week. And for example, need to be able to take leave on a Wednesday or a Friday. In those cases, the paid administrative leave can be used intermittently when necessary, provided again that you are eligible. And so let's get into that briefly. Paid administrative leave may be used under the following circumstances: when you are unable to work due to your own COVID-19 related illness or that of a family member, when you are unable to work because the employee has been directed not to come to the work site, and that's by the employer, for COVID-19 related reasons, and or the work site has implemented a COVID-19 remote work program or is under a shelter-in-place order, but it is not operationally feasible for the employee to work remotely. When the employee is unable to work because of a COVID-19 related school or daycare closure that requires the employee to be at home with a child or dependent, and it is not operationally feasible for the employee to work remotely or in conjunction with the child care commitment. And that goes to the point that I just made about using the leave intermittently if necessary in order to both fulfill your obligations and the essential duties of your position, but recognizing that that may mean a slightly reduced schedule and using the leave as necessary to care for a child under these circumstances. Now, the paid leave is not something where you can just not show up to work and then 2 weeks later say, oh, I didn't show up because of a COVID-related issue. The executive orders both make it clear that you are required to consult with your supervisor prior to taking the leave. Now, that said, both executive orders carve out the exception that an employee may be exempt from using this leave should their absence adversely affect the delivery of essential services, and in particular, those employees working in clinical settings. And I know that may apply to a lot of people on this call. In fact, many of the skilled trades workers that I'm sure are on this call will fall within that exemption because your presence at work is necessary in order to keep the location functioning. For those in the CX bargaining unit, your position may be essential to the continued operation of a hospital or other clinical service or university service. If you have been informed that you fit within the exemption, you may not be eligible to use the paid administrative leave for these reasons. However, that does not mean that you are required to go to work if you are diagnosed with COVID-19 or are in a classification of people who are at particularly high risk of serious complications should you contract the virus, nor if you are required to care for someone that has contracted the virus. Under any of those circumstances, you should immediately seek certification from a healthcare provider that states that you are being advised not to go to the work site upon the advice of a healthcare provider, or obtain a copy of the certification relevant to the person for whom you are caring. Similarly, if you have COVID-19 related symptoms, but you have not yet been diagnosed, and hopefully you won't be diagnosed should you have those symptoms, you should immediately seek a diagnosis. Obtain certification of the fact that you are seeking diagnosis from the healthcare provider and provide it to your supervisor. Simply informing your supervisor that you're sick or not feeling well or otherwise are concerned may not be sufficient in every situation. And so we do impress upon people that just like when you are going to be out of work for an extended period of time due to any other medical condition, do get it certified by a healthcare provider. Now, all of our contracts do contain sick and vacation benefits, as well as rights pursuant to the Family and Medical Leave Acts. Attorney Lorrie Bradley from the Beeson firm will be going that in a bit, but I want to touch on it briefly, that while you may not be eligible for the use of paid administrative leave, or perhaps you've already used up all of those hours, you may nevertheless have the ability to use your regular vacation and sick leave. Use of sick leave for COVID-19 related reasons, such as caring for a child whose school or daycare has been closed, is included in the recent federal laws that Lorrie will go into. As with any use of vacation leave, you do want to work with your supervisor to confirm approval of that leave prior to taking it. And we will work with anyone whose supervisors are giving them a hard time with that respect. Now, finally, if it should come to it and you have no remaining forms of paid leave to use, but you remain unable to work, whether it's because the employer has directed you to stay away, but you were unable to work from home, you should apply for unemployment benefits, which is sort of a misnomer in this circumstance because you are still technically employed. So this would be more of a lack of work benefits. So you are eligible as someone who is not able to work in order to get paid for unemployment benefits because you are ready, willing, and able to work, but there's no work by no fault of your own. So the same is true if your hours have been reduced. If you normally work a 40-hour work week and you have no paid leave left, but the employer is not providing you all 40 hours of your typical work week, you can apply for unemployment benefits to make up for that lost time. Finally, if you are placed on unpaid leave, you're no longer taking any of the administrative leave or other type of leave, you are still eligible for health benefits that you would get where you're working normally, as long as you continue to pay your premiums. And that's something you're going to want to work with us as well as the university in facilitating that. So I'm going to finish up here in just a minute, but I want to reiterate briefly that the negotiated collective bargaining agreements that we have remain in full force and effect during this crisis. The executive orders and new laws add to the rights that we have fought for and negotiated. It does not diminish in any way those rights contained in our contracts. Teamsters Local 2010 is enforcing the terms of our collective bargaining agreements, and that includes the university's obligation to create safe and healthy workplaces. If you believe that your supervisor is not doing that, please do immediately let your field representative know. If you are unable to work for any of the reasons I described, you should consult with your supervisor in order to take advantage of the paid administrative leave and the hours in your paid leave banks. Now, as much as ever, the benefits of our collective bargaining agreements are there for you and your family. And so if you have any reason to believe your department manager or supervisor is in any way not following the rules, is putting you or your coworkers in harm's way, or otherwise acting in contrary to our contract or the executive orders, please do reach out to your local 2010 field representative. So thank you very much for all of your time. I'm going to turn it back to Jason now. And good luck, everybody. Stay safe and healthy.
Okay, thank you, John, for that excellent report, and also for putting on the sharp-looking suit for us. Yeah, you're making us all look good. We appreciate it. But seriously, very good information for all of us. That's very much appreciated. And now we have Lorrie Bradley, who's our attorney at Beeson Tayer and Bodine, union side attorney, who will be talking about the stimulus bills and what's in there that benefits our membership. So Lorrie, thanks for being with us. Take it away.
All right. Good afternoon, everyone. And thanks to all the workers out there who are doing the essential work to keep public services going at this time. I hope everyone is safe and healthy and stays that way. I want to go through the two federal stimulus packages that recently passed. The first one was passed on March 18th, and the second one was passed on March 27th. So in the first stimulus package, there was a paid sick leave benefit and then a family leave benefit. And those, as John said, and as we've discussed earlier, those are in addition to what you have under the contract and the paid administrative leave that you've gotten from the university administration. So this is going to be something that's in addition to what you have to work with, and hopefully that will give some flexibility in getting through this crisis. So the paid sick leave is 80 hours of paid leave at your normal rate of pay. And you can use that if you're quarantined or isolated, if your doctor has advised you to stay at home because of the coronavirus, or if you're experiencing symptoms of the coronavirus, but you're unable to access a test. And that's important because we know, especially in some places in California, there's a shortage of tests. So hopefully this will let people stay home and take care of themselves, even if they're unable to get that diagnosis. There's also a 12-week expansion of FMLA for people who need to stay at home to take care of their children now that there's been closures of schools and daycares. And that is a partial benefit, so you would not be receiving your full rate of pay, you'd be receiving it 2/3 for 12 weeks. But again, that's just one other form of leave that you can access to help get through this crisis if you're unable to work normally, or if there's been some disruption in your home life that requires you to be at home. And then the second package, which is the most recent one, this has some employment enhancements and a cash benefit. And so this is, again, something that is provided by the federal government, but it's going to enhance the state unemployment benefits, including for people like John just mentioned, who are unable to work because they can't, because their job is shut down, because they're not getting enough hours, or for other reasons that they may be willing and able to work, but they are unable to either work at all or to work the normal number of hours that they would work. So the federal stimulus bill enhanced unemployment in two ways. The first way is to add additional money for the first 4 months. So normally when you get unemployment, you apply through the EDD, and there's a benefit that's given based on your salary and your work history. For the first 4 months that you would be receiving benefits, that would be enhanced for up to $600 a week. And then the employment benefits are additionally enhanced by extending the length of them. So that would mean there's an additional 13 weeks of eligibility for people who are unable to work because of the COVID-19 virus. So you could get up to 39 total weeks in California. So not all, if you were out of work for the total of 39 weeks, not all of it would be at that higher enhanced rate. That only lasts for 4 months, and then it would drop back to the normal rate that you would be entitled to under the EDD. But it will extend the length of time that you can claim those benefits. And another thing that I wanted to highlight that is probably not relevant to the members, but it may be for friends or family of yours who might not have a very strong work record of paying into the unemployment system, or if for people who are gig workers, independent contractors, or people who are self-employed, the stimulus package does include a provision for those people to access unemployment benefits, even though under the normal rules they would not. So it's good to share that with your friends and family if they may be in that situation, and let them know that they can access those benefits as well. And like all unemployment in California, you would apply through the EDD, and that application can be made online and on the phone, so you don't have to leave your home to do it. And the normal 1 week waiting period and the requirement to search for work have both been suspended. So you should be able to, as soon as your hours are cut or as soon as you're unable to go to work, you should be able to go in, make that claim, and not have to either certify that you're looking for another job, and you should not have to have that 1 week waiting period. Some other points that I want to let everyone know about from the federal stimulus bill is there's a cash stimulus payment, and that is going to be a maximum of $1,200 for individuals and $2,400, double that for married couples. It will, the full amount goes to anyone who makes either $75,000 for an individual, or double that, $150,000 as a couple. And then it begins to phase out as you get higher than that income level, and it will completely phase out at either $99,000 a year for an individual, or $198,000 a year for a couple. So if you're at $75,000 or below, or $150,000 or below for a married couple, then you should get the full stimulus payment. If you make more than that, then it will gradually decrease until it completely phases out. And there is also a $500 per child benefit. Again, the same income limits will apply to that. And for some reason, my heart really goes out to the parents of teenagers. It only applies if the child is under 17. So 16 years old and younger. Unfortunately, for those of you who have 17 and 18-year-olds at home, they will not qualify for the $500 child benefit. But these benefits don't require an application. They should be based on the IRS filings that you've already submitted in previous years, whether that's in the 2018 or 2019 tax year. Remember, there is a waiver for filing your 2019 taxes, and you should, if you haven't been able to get your taxes in, and you do need extra time to file because of the coronavirus, I would advise you to look at the IRS website, but there is some relaxation of that normal time limit. And a few other things to help people financially make it through the coronavirus crisis. there is an opportunity to access certain types of qualified retirement funds if you're experiencing financial hardship because of the virus. You can do up to a $100,000 withdrawal without penalty if you're diagnosed with or otherwise affected by the virus. And just to clarify, this only applies to certain types of retirement funds that are called defined contribution funds, where you defer the contribution from your paycheck. So that would be like a 401k or a 403b. It does not apply to your pension fund that would be in CalPERS or in another type of traditional pension. And there also are increases on loan limits if your plan provides for a loan. And for those people who are 70 and older and have to take a required minimum distribution, there's been a relaxation of that. So if that is something that you or someone in your community would be helped by that, the place to go is directly to your plan administrator. But there are loans and the ability to take a distribution without penalty if you have some type of financial need that's connected with the coronavirus. There also are some protections and forgiveness for student loans, mortgage, and eviction protections, but it's important to know that there has to be a connection with some type of federal funding of that program. So for instance, people who have federal Stafford loans where the student loan is backed or guaranteed or issued by the federal government, then the payments can be suspended through September 30th. For someone who has private loans or a combination of public and private, there may be some accommodations available from private lenders, but the best thing to do would be to contact whoever is servicing your loan and get the information directly from that private lender. But for any federally backed loans, the suspension of payments is good through September 30th. And again, contact your lender for more details. And the same applies for mortgage relief. If someone needs to request forbearance of a mortgage payment, you must document your need for the relief and contact the loan servicer. But this only applies if your mortgage loan is guaranteed or backed by the federal government or through some type of federal housing program. The same for eviction. There's a 120-day eviction protection, and this is from the federal legislation, so there are state and local protections that may also apply depending on where you live. But just on the federal side, out of the stimulus package, there's a 120-day protection from eviction, but that only applies if the home that you rent is backed or guaranteed or financed through a federal loan or any type of federal program. So hopefully the cash benefit, in addition to the paid leave provisions and some of these other provisions that will allow people to access money in cases of financial hardship, this information is good to know. Just even if you don't need it, there may be someone in your household or someone in your community that would need it. And if you have any questions, I would advise going directly to whether it's about filing taxes, I would go to the IRS. If it's about student loans, go directly to your loan servicer. But it's just good to know that those provisions are out there. They're part of this big stimulus package. And we hope that people can access those in time of need.
Thank you, Lorrie. Thank you very much for that excellent presentation. So now we're going to go through question and answers, and we received quite a lot of questions both in advance of this webinar and also through the Q&A function here. So we're going to do our best to answer as many of them as we can within the hour, and then those that are not answered, we are very happy to answer those offline by email. Also, there's a tremendous amount of information about all of this stuff on the Teamsters 2010 website, teamsters2010.org. Many of these documents, this information, and a lot more. Also, call your union representative with any questions, or especially if there are workplace issues where managers are not following these guidelines, and we will take swift action to make sure that they do. If you don't know how to contact your union representative, go to teamsters2010.org, where you'll find a list of all of our representatives and staff members. So First question, will the 3 weeks of administrative paid leave be expanded? And so, as I've said, we've been pushing day and night to get both UC and CSU to expand that 3 weeks, that 128 hours. CSU did agree to expand it to 256 hours. One of the questions we got indicated that employees didn't hear that officially from CSU, but I can tell you it's a done deal. We have that in writing. The technical letter implementing that change from CSU will be shortly up on the Local 2010 website in the COVID section. For UC, we're going to keep pushing. We have another meeting with top leadership this afternoon at 3. We will keep pushing to demand that the 128 hours be expanded. And we'll let you know just as soon as we have updates on that. Next question. Are we still accruing retirement, vacation, and sick leave during administrative paid leave? And I'm going to turn that one to John.
Yes, so if you are on paid status and you are getting paid, you are accruing vacation sick leave. There's no contract that I've seen of ours that would diminish that accrual during administrative paid leave.
Okay, thanks, John. Okay, the next question is for Lamont. What is our potential exposure for skilled trades workers that are working in the UC dorms? How can we assure that we are properly trained and have the right PPE equipment? What can we do to protect ourselves? And Lamont, while we were sitting here, a couple of related questions came through. So if you're, I'll throw them in there. One person asks about testing. What's the, when and how, under what circumstances should people be tested? And also masks. If the employer does not have an adequate supply of masks, what should we do? Should we be finding them elsewhere, trying to make our own, what have you? So, Lamont.
Okay. Yeah. Thank you, Jason. Well, in terms of having the proper personal protective equipment, every employer is responsible for conducting a hazard assessment to determine, what types of hazards are in the workplace and what type of controls need to be in place to reduce the risk associated with those hazards. So in the case of the trades, if there's noise hazards, if there are respiratory hazards, the employer has to document, that those hazards exist, that they exceed the exposure standards that are set forth, by Cal OSHA or whatever the regulating agency is, and they have to take the necessary steps to provide the necessary personal protective equipment and the training to enable an employee to properly select, use, decontaminate, and store that equipment, that personal protective equipment. Now, there is a lot of discussion about the whole issue of masks. This is an issue that is in flux, I have to say. I just had several conversations with high-level international leadership today about the whole issue of masks. Right now, there is a significant shortage of N95 respiratory protection for healthcare workers. So the question is, does everybody need N95? Well, CDC is not recommending that. And there's we want to certainly make sure that our healthcare professionals who are on the front line in treating patients with COVID-19 have adequate access to sufficient respiratory protection. So, if an employer determines that you have this respiratory hazard exists, they have to provide you with some means of protecting yourself. And right now that's limited to N95 respirators or a high level of respirator. In terms of wearing the surgical mask, they don't really provide any protection to you as the wearer. The idea for the surgical mask is that if you're positive and you're generating droplets, coughing, what have you, sneezing, then the surgical mask would capture that and hopefully protect those who are in close proximity to you. And then there was one other question about the testing. Right now, there's a significant limitation in the number of testing kits that are available. So it's my understanding the people who are being tested are those who are actually presenting significant symptoms. This is a real problem because, like I indicated in my presentation, they're determining that asymptomatic people who are positive can transmit the virus. But right now, we just don't have enough testing kits to test everyone. So that's something that I hear that our federal government is working on developing, getting more test kits, but we're kind of in a holding pattern to see what happens there.
Okay, thank you, Lamont.
Okay.
Our next question I'll take. I have been staying at home since they closed our department and have been using my sick leave hours. Am I entitled for the admin pay without using my sick or vacation hours? So yes, the paid administrative leave that is in the executive orders is supposed to be used first before you use anything that's in your bank. So if that is not being enforced properly, please contact your union representative and we can have that corrected, even retroactively. If they've taken it from your bank, we'll have that mistake corrected. Next question is for Lorrie. What is the relationship between the administrative paid leave given to us at UC and CSU and FMLA unemployment benefits and disability? Oh, you're on mute, Lorrie.
All right, hopefully I'm off mute now. The administrative paid leave is available to anyone at UC or CSU, and that's something in addition to what you have in your contract and in addition to what the stimulus bill provides for. So that's sort of extra. And as John said, there's, you could go ahead and start accessing that administrative paid leave. You don't need to exhaust your vacation before using that. The FMLA is, usually FMLA is unpaid, but because of the stimulus package, there is an opportunity for people to receive the 80 hours, which again would be in addition to what you got from UC or CSU, what you have under the contract. So that's another additional 80 hours for your illness or to care for someone else who is ill. And then there's the 12 weeks of partial pay for taking care of a child or anyone else who needs care and their normal care arrangement has fallen through. Unemployment is available to someone who is willing and able to work, but is not able to work because either your hours have been reduced or you've been placed in a layoff status. And I did see a question in the chat for people who are concerned that applying for unemployment would somehow terminate your employment with the university, and that's not the case. And in fact, unemployment is available for people who've just had their hours reduced but continue to work, say, part-time. And then the final question was about disability. So disability, and for most people working at CSU or UC, is through a short-term disability plan that's separate from the state plan. But the exception may be for someone who is a relatively new CSU or UC employer and has previously paid into the state SDI system from their earlier job. Then if you have those recent credits where you've been paying into the system, you may be eligible to apply through the state's SDI system. If you don't, then you should apply through the program that you have at your university. But that's short-term disability for when you are unable to work, either because of the coronavirus or any other disabling condition. So that's the key difference between unemployment, which is I'm willing, I'm able to work, I just don't have the hours, or my normal place of work is temporarily shut down. Disability would be for I'm too sick to work. It's for my own medical condition. I can't work either because of the coronavirus or because of some other disabling condition. And for most university employees, that's going to be through your short-term disability plan that's a part of your benefits. But for new employees who've worked elsewhere, or if you have someone in your family or in your community who's facing that situation, then you can apply for the state short-term disability, and that's through the EDD, which it's the same state agency that administers both unemployment and short-term disability.
Okay, thank you, Lorrie. Very helpful. And related to the question on unemployment that Lorrie just mentioned, we have several people that have asked the question about layoffs. Will there be layoffs? And so, of course, at UC, we now have the commitment, no layoffs through June 30th. That's a great win for us. At CSU, we're going to push for the same commitment. But then, of course, the concern is, given what's going to happen to the state budget, based on this situation, we have every reason to be concerned that UC or CSU will talk about layoffs. But we are going to push. We're going to keep on pushing to get the commitment that there will be no layoffs, and we're going to fight as hard as we can. We also have protections around layoffs in all of our contracts, requiring notice, preferential rehire rights, that they have to follow seniority, and so on. We're going to enforce those all very closely. We'll be negotiating with UC and in every way that we can to make sure that we avoid layoffs and protect our livelihood, recognizing that this is obviously a very difficult situation economically for our whole country and for these employers. Next, will we be getting hazard pay like other facilities working during this time? And so we've been pushing for hazard pay. It's not required by our contracts at UC. Emergency pay is in the CSU contract, and as I've mentioned, we have won that at CSU. A question that's come in: how is emergency pay structured and distributed? The answer to that is that CSU has put out a detailed technical letter about how it's to be implemented, which will be on our website probably by end of today. And again, go to Teamsters2010.org. There's a wealth of information on there that will answer a lot of these questions. So we've pushed for hazard pay. We've demanded it, but we have no agreement on it. We will continue to push for it, recognizing again that we also have the priority that everyone should stay on paid status, and that no one should lose pay or benefits during this crisis. And as I've said, that's going to be a very big lift for us, but we're going to keep pushing on it as hard as we can. We're coming up on the hour, so we'll do a one or two more. John, this is for newly hired workers. If a newly hired worker must stay home and takes the admin pay, how will this affect the probationary period? And can there be retaliation for taking the admin pay?
Well, first of all, there should never be retaliation of any kind. So if someone feels like they're being retaliated for exercising a right, either under the contract or under any of these new laws, please do let us know. For the most part, probationary workers have to fulfill an obligation to actually work a set number of hours. And so if you are eligible to use paid administrative leave and take advantage of that, it may hit the pause button on the amount of hours that you have worked for purposes of fulfilling your probationary period. But the closest thing we can compare it to is that of military leave under our contract, in which it's explicitly stated that upon coming back to work after the leave, the probationary period restarts again, and the person should be provided the opportunity to finish their probationary period. And so no one's probationary period should be ended if they ask to use the administrative leave. Rather, it should simply hit pause. During the time that you're on paid administrative leave, our position, of course, is that you continue to accrue the same benefits that you would otherwise were you working. But to the extent that those hours that you're on paid administrative leave will be applied to your probationary period. The likelihood is that it would not, but it should not dissuade you from using the paid administrative leave if you need to use it.
Okay, thank you, John. So a couple more real quick questions. UC has given the 128 hours of admin leave. If essentially the question is, what if we don't use it because we're working? Is it still there? And the answer is that according to the terms of the executive order, which is also on our website, those hours stay in your bank until the end of the year. So you can use them later in the year, but only for a qualifying reason, which is the various COVID-related reasons, your own COVID-related illness or that of a family member. You can't work due to closure or because of childcare obligations because school is closed, and any other qualifying reasons. So those hours stay with you till the end of the year. Next, what is an essential worker? Who decides who comes in and who stays home? What if my manager won't telework? So I want to say that in Teamsters Local 2010, we are all essential. And so you can see my background confirms that. Everything that all 14,000 workers that we represent provide essential services, keeping UC and CSU running. Now, during this crisis, some folks have been called in to work because they are deemed essential from the point of view of keeping operations going. Others are continuing to work. Many thousands are continuing to work by teleworking from home, and others have been not able to work. Generally speaking, the employer makes these decisions under management rights, but they have to do it within the confines of our contract, which means a safe and healthy workplace, and also following the requirements of the various stay-at-home orders. And so if people are being called into work when they really shouldn't be, or if it's under unsafe conditions, or if people are being denied reasonable requests to telework, then you need to let your rep know, your union rep, so that we can act on it. We've been successful in getting thousands of workers the right to telework when UC at first denied that right. And there's lots of different ways to telework, and we have the right to get creative. For example, even if most of your work is done on site, like skilled trades or childcare, there's things that can be done at home, like training, like administrative paperwork that may be backlogged, and so on. So we will demand not only that we have the right to telework, but also that the proper equipment and resources are provided to make that possible. So very important to contact your union rep if there are any issues around that. So we actually have answered many of the questions. If your question did not get answered, please send us an email to info@teamsters2010.org, or you can go on the website and click on where it says to ask us a question, or you can call your union rep and ask the question. This webinar is being recorded and will be on our website. So if you want to listen to it again in case you missed anything, or if you want to urge your coworkers to check out this webinar, it will be available for everyone to review. And we've had, Matt asks how many callers. We had over 500 people sign up to attend this, and we have close to that number have signed in. So we're very happy with this. We're going to do additional webinars going forward to keep providing critical information to our members through this crisis. Now I want to turn it over to Catherine Cobb, President of Teamsters Local 2010, who is going to give our closing remarks.
Good afternoon, everyone. Thank you, Lorrie, Lamont, John, and Jason, for bringing great information to help all of us. And thank you to those who took the time to call in with your questions. These are challenging times, so please remember to check in on your families, your neighbors, your friends, and especially those that are 65 and those at risk. Please continue to social distance 6 feet and stay shelter in place at home. and stay safe, everyone. Take care. Jason?
Thank you, Catherine. Thanks to everyone for being on this call. I want to tell you that this will be on the website, and also all questions that weren't answered will be forwarded to your union representatives. I want to urge everybody that's on this call to take a minute to sign the petition. You should have received an email from us that we have our petition demanding that UC and CSU institute no layoffs or loss of pay. In about 24 hours time, we had over 1,000 members sign that petition, and we've been winning, but we need to keep signing, keep pushing this issue. So please go sign the petition. I want to say that, we've received many inspiring messages of thanks from our members during this time. There's one I want to highlight out of many dozens that our member Diana Lopez at UCLA, she said, quote, "Thank you so much for such quick action, taking care of our members at this time of uncertainty. We are making Teamster history, something that won't be forgotten. Teamsters don't fear COVID-19. Together we'll beat this." So I want to say thanks to all the hardworking, that's end quote. I want to say thanks to all the hardworking Teamsters of Local 2010 for your service to our state. And thanks to our dedicated Teamsters officers and staff for your service to the members, keeping us safe and our jobs protected. I'm always proud to be a Teamster, but I'm especially so at this moment in history. Let's keep working hard and standing together to serve our state and to protect workers' safety, rights, and livelihood through this crisis. Thanks very much for being on this call.